Hi, everybody. It's Dr. Eric Balcavage, and I'm here with my partner on the Thyroid Answers Podcast, Dr. Erica Riggleman from Winchester, Virginia.
Yes.
Right? All right, Dr. Erica.
Hi.
So today, this is our 9th episode of the Thyroid Answers Podcast. For everybody who's found us, is downloading us, we really appreciate that you're downloading it, that you're enjoying it, you're learning it. We just hit our 2000th download of the podcast between yesterday and today, so we're pretty excited about that.
Yeah, that's awesome.
Yeah, and we are excited because we're going to be getting some really great guests on the show in the future. And so Dr. Carrie Jones is one of those people we're looking forward to having on the show, and that's one of the reasons we've been talking a little bit about the connection between the thyroid gland and hormones, and definitely the tie-in between the thyroid physiology and cortisol. And today we wanted to touch base and get into a little bit more in depth on the connection between estrogen and thyroid physiology.
Yes, so, definitely. Thyroid and estrogen they play off of each other. One impacts the other, and the symptoms can be very mingled. So it's often hard to distinguish whether, just symptom based, whether you're having an estrogen issue or you're having actual thyroid problems. But when it comes to estrogen, what would you, why don't you describe the 3 forms of estrogen? Because a lot of people don't realize that there's multiple forms of estrogen. It's not just this big one umbrella of what estrogen is.
Yeah, estrogen is broken down into 3 main forms: estriol, estrone, and estradiol. And so there should be this kind of balance between the 3 of those. And we need to really, when we're looking at thyroid hormones, not just look at estradiol, which is typically what most people take a look at. Mm-hmm. We really need to take a look at all 3 of those. What's even more important is we need to understand what the estrogen levels are, but we also need to understand what their metabolites look like in the body.
Absolutely.
So the primary estrogens break down into these secondary estrogens, things called hydroxyestrogens. There's a 2-hydroxy, a 4-hydroxy, and a 16-hydroxy estrogen. And these then have to go through a second phase of detoxification and go through what we call phase 2 detox, where they're kind of detoxed out of the system with the benefit of bile and end up into your GI tract, where they go through phase 3 of detox, and they get into your GI tract and go out in your stool. So one of the most important things for people who are looking at hormones is to make sure they get a good hormone test that looks at all 3 of the primary estrogens and their metabolites. That's really important when it comes to looking at estrogen physiology and the role it may play with thyroid physiology, and whether you have symptoms. If you have symptoms of estrogen dominance or low estrogen symptoms, you really need to know what all levels are.
Absolutely. And a key thing to realize is that when you have low thyroid function, you're going to favor one form of that breakdown a little bit more than the other. So your overall estrogens look good, but you may be breaking it down, a little bit differently. So getting that breakdown is really, really crucial. Plus, thyroid conversion, most of it's going to happen in the liver. So if you're metabolizing estrogens there and you're converting thyroid, if you have an underlying liver issue, you're definitely going to have effects, affecting both of those pathways.
Right. So there's problems with estrogen, right? You need a normal amount of estrogen. There's kind of this bell curve as far as estrogen goes. Too little, not good. Too much, not good. So Dr. Erica, why don't you tell everybody what some of the symptoms might be of low estrogen, and then explain what some of the symptoms of high estrogen may be.
Yeah, definitely. From a patient perspective, you want to know what signs or symptoms may you be presenting with. It might give you a little hint, especially if you don't have a test readily available to you. You can look based upon symptoms. It may not be the most accurate, but we can kind of get an idea whether you're in estrogen dominance or you're in lack of estrogen. So if you're looking at low estrogens, you could be having hot flashes. It could be mood swings. Could be depression. You could have obviously bone-related issues. You could have osteopenia, osteoporosis. It could be have painful sex. A lot of times you have vaginal dryness when you have low estrogen, especially that E2 or E3 is the big one that goes along with that in having those low estrogens. And so big causes to why you could have low estrogen. You could be over-exercising. And so there's multiple effects of when you have over-exercise, it affects not only the cortisol, but it can lower estrogens. You may not be eating enough. So if you feel like you're gaining weight, a lot of people go into these starvation diets, and that in itself can lower estrogens even further, creating more of an imbalance as it relates to, your estrogen levels in your body.
And to some degree, when people are trying to lose weight, for years people have been told eat a low-fat diet. That too plays a major role in the body's ability to make estrogens, correct?
Absolutely. Yeah, it definitely does.
What about high estrogen symptoms? What would we expect with somebody who's got estrogen dominance or high estrogen estrogen levels in their system?
It could be, breast swelling or tenderness. It could be low sex drive. It could be bloating. You may have irregular periods. A big one that I see is headaches in the office. So that's a big common one, especially around your cycle when estrogen's going higher or lower in your body. You could have weight gain. That's a big one. And there's a lot of different reasons why people can have high estrogens. You could be over aromatizing some of your other hormones. You could have blood sugar dysregulation. So insulin drives people to make more estrogens. So it could be sugar dysregulation, overconsumption of sugar, or maybe you're consuming endogenous, estrogens. Maybe the milk that you're drinking has hormones in it from that they were giving the cows. Maybe the meats they had been feeding the animals hormones to make them fat and to plump them up so they get more meat off the animal. Maybe you're being exposed to BPAs. Maybe it's in your beauty products. That's a really big one that I see, is that anything you put on your skin gets absorbed, and they're estrogen